So, one of the most fun things about being a practitioner who uses and practices integrative medicine in the bioidentical hormone community is that we get to make very custom, you could even say niche products for our clients that fit their wallet, their lifestyle, and then their medical needs. For example, let's look at this here. This is called a mega pump because look, that's pretty mega compared to something like a ticker, which this is a pretty standard one. It comes in 0.25 mLs per click. But I also work with a different pharmacy that uses 0.05 mLs per click, depending on who's in front of me. So for example, let's see this mega pump here, excuse me on the noise. It is a deliverable product that per pump will get you the right amount of what you need. Now a ticker instead will expat, or oh, this one's not quite working, but it'll produce a little bit of hormone cream up the top for you. But why you might use this one versus the pump is the pump, you put it right up on your skin and you deliver this rubbable cream. However, before I get my ring dirty, I'm gonna take that off. When you use this ticker, instead of actually touching the product yourself, you can just rub it on your surface area wherever you desire. So there might be different reasons for doing that. But what I love this is because we have options of things. For other people, we have things like triturates. Anybody ever heard that word before? I hadn't until I basically got a hold of bioidentical training. Looks kind of like a Tic Tac, you know? And you put that under your tongue, it dissolves sublingually. We also have things called ready dissolvable tablets. These are just as they sound, ready to dissolve. They go under your tongue, but these are more expensive than the triturates. However, these both can hold different potencies. And so the fun of being in the bioidentical hormone community space is that, again, we get to choose what is the right solution for you based off of certain criteria of different things. And so most women prefer, when it comes to hormone therapy creams, easy to put on the body, absorbable through the skin, although site absorption does matter and make a difference, especially if you're using testosterone versus estradiol. There can be different reasons to place something on the labial surface versus your inner thigh versus your flank or maybe your inner forearm. And so those are also, always conversations that you want to have with your provider. But also, certain products can't sustain a shelf life that's this big for a mega pump, and they have to be put in a ticker. But there are also different cream bases when we're looking at just a mega pump versus a ticker. Well, what's the cream that's inside of it? The three main creams that we get to use when it comes to hormone therapy, which predominantly, if you come to my clinic, we will be using creams in estradiol and testosterone. Again, not as big on the progesterone, and we can tell you why when you get here. But what you can choose on different bases and for different reasons. One is called HRT cream. As it sounds, maybe it should be called BHRT just so we don't get confused, medical community. But HRT cream is the most generic form, I think is the best way to say that. It is easily absorbable through multiple spots in the body, a little thicker than what we would call Versabase or Elage. Versabase is more silky. Can have some issues for people if you use it in the vaginal region because it can disrupt the pH. It's not very pH balanced. And so if you're prone to yeast infections and such, we don't want to use a Versa-based cream on you. However, some women do prefer it because of its consistency. And then something called the Elage cream, which is more what I would liken it to hyperallergenic needs. And so if you have irritation on the skin from the HRT cream, or if it's maybe not absorbing perfectly and we just want to try a different vehicle of delivery, Elage would be kind of our third or second preference, because usually I do HRT cream, Elage, and then Versabase is kind of the last resort option. Every provider will have a different preference as to what they use and why they use it when it comes to creams, and we're talking just about creams. But going back to the original discussion, original topic, this is why hormone therapy is so fun, because we haven't even gotten into the injections, which is usually more for males when it comes to testosterone than it is for females with certain things. But working with hormone therapy providers, bioidentical hormone therapy providers, you should know that you do have a merited discussion with your clinician to ask, well, why do we use the injection? Why do we use a cream? Because there are different research-based outcomes depending on the form of delivery. And so they should tell you those things. They should make you aware of why and where we're putting them. For example, testosterone placed on the labial surface will aromatize into a little bit of estradiol, and that will help with vaginal lubrication. But if you put testosterone in the inner thigh, it might not really help the vaginal lubrication as much as it would if it was on the labial surface directly. And so, fun things to know, fun things to play with when it comes to choosing what product, what cream, what triturate, what troche. We didn't even talk about that one. What ready dissolvable tablet or injection. But those are conversations that you can have with your bioidentical hormone therapy provider and see what is the best fit, best solution for you and the team.